try to do the best to give you a moose-boosh of what self-care is about. And I want to tell you how it came about. COVID really had transformative effects on all of us. But I was very surprised with how much it changed me personally. I had deaths in my family. Various members of my family got COVID. My friends, my colleagues were losing their families too. In the time that I've been a physician, I've never seen so much death in my life. It's almost like the spirit of death came and grabbed all of the people that needed to go at this time. So I felt that death was touching my hand. Death is holding my hand. Then I began to find out that many doctors were killing themselves. They're not just seriously burnt out, but they had such mental health issues that they were really killing themselves. And I looked into this further to recognize that this is not just an issue now. It turns out to be that it's been a long-term silent epidemic that doctors suffer quite a bit. They don't even know it. And then they go on eventually to, some of them, kill themselves. My daughter is an MD, PhD student and happened to be in the trenches working with COVID patients, carrying their samples from the ICU to the research lab where she was working. And somehow my heart was touched in such incredible ways, because it wasn't only my child, it was not only death that was around us, but I remembered myself, my own story. I was one of these people when I was in my training who experienced deep disappointments and sadnesses. And at that time, I wasn't ready to deal with them. And I myself went to that edge where your resilience is tested, as is your ability to cope. So I will be sharing that story with you as part of the message that what saved me was my gateway to the wonderful life I have, was that I became an expert in self-care, my own self-care. And that was not just life-affirming, but life-giving. So at the end of the day, I thought, why do you want me to give you another endocrine lecture when we have Cesar Pellerano, a great cardiologist, giving you wonderful world-class endocrine experiences and hormonal therapy? What I really need to do to transform and to help people is to be able to share my story and to provide healing at a greater level. It's not just about the treatments we do, it's not about the hormones, we can throw the whole kitchen sink of supplements, but at the end of the day, if you're not whole inside, nothing works. And having an authentic life requires the openness to be present inside as we take care of the outside. Now I'm taller than my husband. Okay. So I hope that at the end of this lecture, you will leave with the knowledge and understanding of the importance for each of us to know self-care, because if I talk to one of you, you will share it with 10 others, and we will have a transformative effect with our colleagues and our friends. I hope you leave with the thought that self-care is a life-saving skill. We can all learn the skills to take care of ourselves, but it requires intention. Our practice of self-care not only transforms us, but transforms others. And through our transformation, we can be guides for our patients and our colleagues to be well. So we here at AMG are a particularly lucky group. We're the 30% of unhappy campers in conventional medicine that chose to jump out of the hot water and find a different pathway. And because we chose that, that makes us different than the group that doesn't leave and continues to suffer. In some ways, the fact that we left and are here shows that we have some degree of self-preservation and dignity about how we deal with our lives. And perhaps that prevents this group from burnout and suicide. So I want to give you why this happens. We physicians give a lot from the time that we're very young. We give up a lot to become doctors. Then we give a lot to others, and we carry a lot of burden from other people. We have unique characteristics that got us in medical school in the first place and in professional fields. And these characteristics are blessings, but they're also swords. And lastly, we train in a system that changes us. And over time, we lose our humanity and our ability to know ourselves. Therefore, we become vulnerable to self-neglect. And in fact, we become disenfranchised from our own selves. So why does this happen to us? Let me tell you the characteristics first, and then the systemic things that happen. So as a group, we're professional caregivers. We're goal and achievement oriented. We're very competitive, very perfectionistic and demanding of ourselves. Many of us have unrealistic expectations of what we can and cannot do. We're self-critical. And this self-criticism and negativity makes us feel that we're never enough. There's never enough. We can never do enough. We forget that if we fail to meet the mark, it's going to be okay. And perhaps we never heard, or we were not taught, to accept ourselves in our own human imperfection. People count on us to be tough. They want our advice, they want our presence, they want our backup. And slowly over time, we become stronger, yet we recognize that we have to be strong all the time, so we can no longer be vulnerable. This lack of vulnerability is, or showing vulnerability may seem as being weak. So asking for, and now moving on to the systemic situation, from the time that we're in medical school, internship, residency, we have to give up a lot of our own needs to take care of others. We often hold off what we need to do, even going to the bathroom, because we're having to take care of others. At times, asking for help may seem shameful or seem like a failure because we should know better. There's also stigma and shame and repercussions about expressing how we really feel. Many of the forms that we fill for credentialing in our hospitals or forms that we fill for insurances have these difficult questions then ask, have you been sick lately? Have you had psychiatric conditions? And we're horrified. This is like they ask, we don't tell. And this situation really prevents us from, we're fearful about saying how we feel. So there's a combination of factors from the environment and from ourselves that make us less able to express our vulnerability and our humanity. The other big issue is that we're all in our heads. We're all thinking, planning, doing, saying things to ourselves, saying things to others. So in some ways, we become disconnected, as if the mind and the body were not to be together. Being in our minds all the time can actually be quite dangerous, because when you're not embodied, bad things can happen. So the combination of our nature and personal characteristics, along with our medical training and the work environment, creates unspoken contracts between the people that know us and us, between the work environment and us. And that's really very important. And it maintains a system of secrecy, disempowerment, which is bound to produce loss of wellness. The training makes us sick. We get burnout, and at this time, sometimes suicide. And the interesting thing is that many of us don't even know that's happening to us. We don't even know that we've lost connection to ourselves, to our dignity. So, as I mentioned, the pandemic made public and unearthed the stress of physicians for everyone to see. Physicians had stress and also carried the stress of their own patients. It's a double whammy. We had responsibility, so much responsibility. Physicians experience higher rates of mental health, like depression and anxiety, since the pandemic. European data just published combining the Italians, Spanish, and UK evaluations from doctors showed that 25% were experiencing anxiety, 20% experienced depression. Women were more affected than men. And a Mayo Clinic study published this year showed that 1 out of 15 physicians had considered suicide. Burnout starts early in residency. And at this point, I'm shocked to tell you that 37 to 40% of endocrinologists are burnt out in my own field. And the burnout is a combination of the workloads, the loss of autonomy, less control over the schedule, the bureaucracy and time-consuming of documentation, and the lack of personal protective equipment that many people felt. They were unsafe in the outside, and they didn't know that they were unsafe on the inside. So let me tell you my story. But before I do that, I want to tell you that we doctors are less likely to seek help when we need it. We're more likely, we do know where to send people when they need help, but we're not going to go there, and we're not going to ask help because of the stigma and repercussion and shame that may be associated. Maybe we lose our ability to have progression in our work fields. We may be stigmatized by other colleagues because they may feel like we feel, but they separate themselves from what is really happening. So 15 to 20 physicians actually treat themselves with antidepressants. And 20% of physicians have dependency and addiction. Men are more likely to use drugs, and women are more likely to use alcohol. So I really experienced this paradox myself of this sense of being in a hard place and unable to see how I could help myself. And the story happened when I was after my endocrine fellowship training, I went to the NIH and worked for 4 years. At that time, my husband and I and our 2 little girls went to Bethesda. My husband was working as an orthopedic surgeon at Walter Reed Medical Center. And I was at the NIH running a research, I had my research lab and a clinical unit. And at that point, our girls were little girls. And there was no family there. Our work, it was all about our academic careers and the children. So with 2 days notice, in my 3rd or 4th year at the NIH, we got a call, and my husband was taken on a 6-month tour to Haiti. And I couldn't talk to him for 6 weeks. So I got left by myself with my 2 little girls and the work that was going on. We had been able to manage this with the 2 of us, but now he was gone. And shortly after that, the administration where I was working changed, and the support that I was receiving was diminished. And I, all of a sudden, saw myself in a different place. I'm a Cuban. I'm a political refugee and immigrant into America. I've had to work harder than other people to be seen in my mind and to be valued in teams that don't accept people from other places. In addition to that, I'm a petite woman, and that combination of factors makes it harder, and we have to work harder to prove ourselves to get someplace. I took it very personally because at that point of my life, I defined my success by the work that I was doing. I wasn't wise enough to be centered in the fullness of myself and the fact that it's my essence that is what matters and not what I do. But I was young then. I couldn't wrap myself around the fact that my job was different, my husband was gone, and I really, really became deeply depressed. And I was so angry with myself. I felt so ashamed that I could feel this way and that I couldn't fix myself. I should know better, shouldn't I? And I shouldn't tell anyone. I can't tell my parents, are you kidding me? I am here, I want to please them. I can't disappoint them. And I couldn't tell other people because they wouldn't understand what was going on. If it hadn't been for my 2 little girls, who knows what might have happened? But instead, I decided to begin a process of self-care, which involved starting Jungian psychotherapy. And through that process, I began to understand that I had lost my own dignity. I had lost a sense of my humanity. I wasn't letting myself be vulnerable, and it turns out that in being vulnerable, that's how we live. That's how we truly connect to ourselves and to those around us. So it was with my own self-care that I began to respond, and my life became more affirming, and I really survived. And I really, it's this incredible awareness of recognizing with humbleness that I'm just like everybody else. We doctors are like everybody else. It's okay for us to be who we are and to feel the things that we do. So as it turns out, my self-care is my own personal protective equipment. We all use personal protective equipment outside, but I use personal protective equipment inside. The pictures that you have been seeing here are all my artwork. My art anchors me into my own feelings, my own emotions, and I express what I'm feeling at a deeper level, and art connects all of us, and we see things in a different way, in our own way. So, self-care returned to me my agency. I'm in charge of my own life, and I am here really to talk about it, because if I talk about it, then somebody else will have the courage to talk about their stories, and somebody else will have the ability to reach out their hand and touch someone who's not feeling well and say, hey, I'm here for you. So, as I said, there's a better way to heal, which involves awareness, as I'm sharing with you, and self-care. So, awareness allows for new ideas to happen, for us to have questions about what it can be. We can develop new visions. And once we have a vision and we create directed action, we can actually have transformational changes in our lives and in our work communities. So what is self-care? You may not be able to read this so well. So I'll tell you that I looked into different places. I looked at the dictionary, at the National Institutes of Mental Health, and the World Health Organization. All of the definitions are very similar with different variations. The bottom line is that self-care is an active role, and it is your defense against whatever happens around you. That is self-care. So self-care can be learned. It is like something that you cultivate, like a garden. You begin with a few seeds, and then at the end, with regular tending, you have a beautiful garden at the end. Self-care embraces the fact that we matter, that we're human. We're all perfectly imperfect. And we're vulnerable, yet so capable, all at the same time. We're whole. There's a huge amount of data that shows that self-care improves health outcomes, and it is clinically proven to reduce and eliminate anxiety, depression, and other mental and psychological conditions. So what is the price that we pay for not caring for ourselves? So it's quite a bit. First, energy loss. We don't have enough motivation. We don't have desire. Loss of libido, which may or may not be helped with some testosterone. Less intimacy. Physically, we feel heavy. Stress, and stress is inflammatory. So even our joints hurt. Emotionally, we may have more conflicts with others. We may be more disconnected from our families, from our work people. Psychologically, we may feel so stressed that we may react abruptly to things that come up rather than responding wisely and giving a better option to the people around us. We isolate ourselves. We want to avoid others. And actually, we find seeing another patient a burden. Functionally, we're less effective. We actually, through that process, become less prosperous financially, less prosperous in our relationships. There's a concept of presentism. We're present, but at the same time, we're absent. We're not there. Escapism is using unhelpful habits, and there's a series of them. One of them, which I wasn't really thinking about, but makes a lot of sense, is the idea that we're always very busy. We're very busy, so we have time for nothing else. We're busyness. There's also food, of course, alcohol, drugs, sex, internet. We come from a sense of contraction. We have lack. We lack abundance. And lastly, we have mind-body disembodiment, which I talked about. And actually, this is what leads to suicide. The more that we're in our heads, the more that we're no longer connected to our bodies. And that's what allows people that commit suicide to move on. So what interferes with our ability to care for ourselves? And it's really the stories that we tell ourselves to justify why we cannot be kinder and more compassionate to ourselves. The stories come in black and white or either or. For example, no one has my problems. If I share my problems to others, I'll be judged or penalized. So something bad will happen if I do something. There's not enough time in the day to do all of the responsibilities I have, and less for myself. It's other things or me. So these thought patterns make it clear that we value and prioritize others' needs and expectations, and it fuels irrational fears at the expense of our own self-neglect. These stories over time support the belief and message that we really don't matter. that we're bad or incompetent, advocating for our own self, time, and care. So these dysfunctional interpretations fog our minds from clear thinking and support our need, probably from a basic level, to please others and manage perceptions as to how others see us. So we have normalized these stories of putting ourselves last. So what is your story for not resting enough? For not exercising regularly? For having less time or less of a healthy diet? Maybe you feel so deprived that you don't want to deprive yourself of the Cinnabon that they have in the cafeteria. What is your excuse for not having more quality time or intimate time with your partner? For not being able to have a better weight? So how do we fix this? To disrupt these limiting thought patterns and stories, we first have to become aware of them. So you have to bring them to consciousness, and actually you have to give them language. We have to have a language that we can begin to see and understand. And actually this is what I'm doing. I'm creating a language for all of you to tell this language to other people about what happens. Once we have a language, then we can see what's going on. And we can begin to understand and see the problem differently. Gee, I didn't know I had that problem. Now that I think about it, I do. So once we acknowledge the story, we have to do it non-judgmentally, because remember that when we're in judgment and criticism, there's no possibilities. So you have to get out of that space. And then you have to be curious. Once we're not judgmental, then we can be curious about what are the other new possibilities. How can I reframe this old story and tell a new one in a way that is more nurturing or supporting to me? And then you can practice it until you get better. These are some examples of reframing ideas. I used to think that everything took a lot of time. I used to think I had no time for the things that mattered. Now, I think even though there's so much to do, there's always time to do what I value the most. There is time to do that which matters to me, that which matters to my family. Actually, after practicing this, honoring my values takes very little time relative to the joy and pleasure it gives me. I used to think I had no choice about how much time I spent at work. Well, it turns out that I actually had a choice, and it is normal to create boundaries between my work and my personal and family life. That is actually possible. It's useful, and it helps me to be more efficient at work so that I can have more time with my family. I used to think that I could not help my situation, nor that of my colleagues, but now I know that I can call my hospital and I can ask, what are they doing to support physicians? I can call my societies and say, what are they doing to change the punitive and alienating language in the process of credentialing us doctors? Why is this continued? Why are we allowing this anymore? And this is actually happening in many state societies. One more. I used to think that meditation was weird, not for me, and that my brain was too chattery. I now learned that taking just a few minutes every day to breathe and feel my body, regardless of how busy my mind is, actually helps my mind and body align and to be more calm. Once I practice this regularly, it doesn't work all the time, but as time goes by, I feel calmer and I'm better able to respond to the things around me. So consider caring for yourself as if you were your own child, or if you had a friend that was coming to you to ask you for help. How would you advise your friend? What would you do for your child to help him or her thrive and succeed? What wouldn't you do? So we take a stand for ourselves and we decide that we're going to be the captain of our ship. We're going to navigate our waters. It has to be some action. Sometimes we don't know where we're going to start. With my situation, what I did was make a decision to go and have my nails done. I had a manicure once a week while my husband was away and he wasn't touching me. And it was remarkable what doing my nails and having a hand massage with this nice Asian woman did for me. I left transformed every time I went, and I actually made that as important as it was to being on time to my work, on time to picking up my children at the child care center. I made that a priority. So you prioritize, you make it pleasurable, and then you plan to be consistent about it. So it's important to identify what aspect of you want to change. It could be physical, it could be emotional, could be psychologically. What part of you? And you need to take time for this. This is not something that you can do in 5 minutes. So you have to sit down and think about it and give yourself that gift. A more important question is, what do you need of yourself to prioritize your self-care? And that's harder, because that means that it may ask, do you have the courage to do that? Do you have the courage to talk to your family? To say, gee, I think some of us should spread out the responsibilities of the house so I can have more time to do other things, because everybody assumes that things are the way they are. So once we identify that area of self-care, then we have to link it to pleasure. So I like to start with the body first, and it's the easiest to start with. Once you start with the body, that's the fastest way to connect to the rest of you. And you have to make it pleasurable. So for example, you could be on the treadmill and you could be listening to a TED Talk. You could be on a walk and decide for every walk you're going to go along your Rolodex and call a friend you haven't talked in a long time. So we do things and we link them almost like Pavlovian conditioning. So we begin to salivate about doing something nice for ourselves because something good is going to happen. We have to have fun taking care of ourselves. And of course, I always like to remind everyone of the ABCs of self-care, which are good food, good sleep, good movement, good connections, and good stress. What's good stress? Being a little bit short of breath when you're exercising. Being hungry during the day. It's good for you to be hungry during the day. And lessening or fighting against the bad stress by meditating, exercising, or doing whatever it is that we do. That makes a difference. So, for this last session of this practice, I'm going to ask you, I'm going to take you through 3 short vignettes that embody the value of self-care practices. All 3 of them demonstrate how presence and sensory pleasure in the moment of the experience can create abundance and well-being. The first one is going to be about going to sleep. In the second one, I'm going to take you to a time being with one of your best friends. And in the last one, I'm going to take us to making love. These are just a few examples of living our lives fully and authentically. I hope your mind travels to these places that I take you, and that you can visualize yourself in them. To start with, I invite you to close your eyes, and you can choose to keep them open or keep them closed, of course. I often use this simple stress-reducing technique with my medical students to sharpen their minds. The process of placing attention with your closed eyes on the breath allows our bodies and minds to connect and to be more inner-centered, more open, and more receptive to the conversation, and more creative and focused in our participation. So let's bring our energies now and full presence to our body. Place your awareness on the breath. Take slow in and out breaths, and let that air be felt in the back of your throat. As you breathe in and out, go down to your belly and feel it expanding. Go further down and move to your hips. Put your mind's eye on your hips. And now bring it down to your buttocks. Feel the heft of your weight, if you can, on your seat. Once you feel that, take your mind's eye to your feet and feel your feet as they touch the floor. Feel that sensation as you continue your relaxed breathing. Take one or two more cleansing breaths, and let's start. It's that time of the day when you're sleepy, so you listen to the sensation and decide to go to sleep. You enter a beautiful bedroom which has perfect temperature for you. Your pillow is fluffy. The cool sheets are smooth and soft. The room and bed are very inviting. You write in your journal gratitude for something positive that happened in your day. You know that you have already reviewed and listed the tasks and responsibility for tomorrow. You've done enough for today. You may receive a loving hug and a kiss from someone you love. You turn off your light and your body slowly relaxes as you go into a deep, deep sleep. You have delicious REM cycles with dreams and lovely journeys. You don't have to get up to go to the bathroom. You stay suspended in this state of unconscious recovery for 7 hours. You spontaneously awaken at the right time. In the morning, you stretch your body, and as you rise, you feel so rested. There's not an ounce of body ache or hesitancy. You sit for a few minutes and focus on your breath and your body to consciously align with your mind. You go off to your day with a calm and positive attitude to fully give all you have to offer. Let's make time for meaningful conversations. You create the opportunity to spend quality time separately with one or two of your dear friends. They know who you are. There is no effort needed when you are with them. You talk, they listen. They talk, and you listen. You share deeply. They touch your heart, and you touch theirs with your stories. You tear up, you cry, you laugh, you lovingly tease each other. You walk the path, and as you talk, you see nature, and in it, you see yourself. You discuss ways to look at and embrace the challenges, the grief, and the doors opening ahead. At the end, you feel so served and nurtured by the opportunity of just being and sharing while held by empathy and positive regard for one another. You leave thinking, wow, these relationships, these conversations matter. They heal us. They give us so much meaning to life. Perhaps this is the reason for our presence. Lastly, let's think about making love today and take ourselves to that awareness. You see your partner and you walk towards them. They look at you and smile. You reach out and hold hands and you embrace each other. You breathe deeply and smell the scent of their skin, their cologne, or their perfume. You kiss and touch each other's body. You allow yourself this precious time for your body to be caressed and loved. You feel wanted. You see your partner's pleasure. If you're in a long-term relationship, you're so touched by the love you have shared for so long and how sensual and fresh it continues to be. You sink into this feeling of closeness and satisfaction. Your hormones and nitric oxide and blood flow naturally work. You feel engorgement and excitement in your sexual organs. Your penis and vulva are engorged and fluid. You're now fully present for the sensation of your body. You go deeper and deeper in this intimate connection where you dance and allow all centers of your being to feel the pleasure of this time. Your body and energies merge and expand, bringing you release and closeness. Your oxytocin flows and your senses alertly feel the sensual embodiment with grace. You feel gratitude. You transcend. If your eyes were closed, you may open your eyes slowly and return to the room now. I'll close with a few questions for thought. How would it feel if self-care was an integral part of your life? Is this an opportunity to become a caretaker for yourself? If this was the time to say goodbye, do you have the right relationship to yourself or to others? Have you made the requisite investments to ensure and maintain those relationships you say you care about? Do you have the compassion? Can you show the grace and courage, the acceptance and forgiveness that may be needed for yourself and for others to repair the issues that are interfering with happiness and joy in your life? Resources are available to us, and I have listed them in your presentation. There are places that we physicians can go and ask for help and maintain anonymity without paying money or for very little money. So let's help each other be well. I want to invite you to talk to others, to create conversations on this topic, because this affects all of us, our colleagues, our friends, our children. Let's figure out how we can create more connections, more support, more acceptance for each other. How can we teach each other and support each other to self-care and having an authentic life? Let's include each other in our circle of care and give the dignity to each other that we all deserve and is our essence. I thank you all for your presence and participation in this session. I wish you well, and I wish you have a nice lunch. Thank you.